If you're being treated for BV but your symptoms keep coming back, there's another infection that often gets missed. It's called Trichomoniasis, often shortened to Trich, and at first glance it can look really similar. In this video, I'll explain what it is, how it's tested, what treatment involves, and how to protect yourself from reinfection. And we're going to take the shame and panic out of this and replace it with clarity. Because if you've been stuck in a loop of treatment, temporary relief, and symptoms returning, you're not failing at hygiene. You may just be dealing with the wrong diagnosis or more than one issue at the same time. So let's go step by step. Trichomoniasis is a sexually transmitted infection caused by a microscopic parasite called Trichomonas vaginalis. In women, it mainly affects the vagina and cervix, and it can also irritate the urethra. That's why some women notice burning when they wee as well. And here's why it can be overlooked. It isn't talked about as much as chlamydia or gonorrhea, and not every routine discharge swab automatically checks for it. So it can sit under the surface or keep coming back unless it's specifically tested for. The good news is it's treatable, it just has to be recognized first. First, an important truth. Some women have no symptoms at all, but when symptoms do show up, they can include discharge that's different from your normal, sometimes heavier, sometimes thinner, and it may look yellow or green, a strong or unpleasant smell, itching, burning, or soreness, discomfort during sex, stinging or burning when you pass urine, and sometimes bleeding after sex or spotting because the cervix and vaginal tissues can become inflamed. Here's the key point. You can't diagnose Trich or BV by smell or colour alone. Those are clues, not answers. But if you keep being told it's BV, you keep getting BV treatment and you keep coming back with irritation, especially if sex is uncomfortable or weeing stings. This is your moment to pause and say, we need to rule out Trich. Trich is usually passed on through sexual contact, most commonly vaginal sex. It can also be passed through sharing sex toys if they aren't cleaned properly or covered with a new condom between partners. And I want to be really clear. This isn't about being clean or unclean. Trich is an infection. You can shower twice a day and still get it. You can be in a committed relationship and still find it comes up. None of this is a character judgment, it's healthcare. You should book an appointment with a sexual health clinic or your GP if symptoms come back after BV treatment. There's persistent discharge or smell that isn't settling. You have itching, burning, or soreness that keeps returning. Sex has become uncomfortable or painful. You have urinary burning. You've had a new partner, unprotected sex, or any STI concern. Or you're getting bleeding after sex repeatedly. Now, urgent signs matter too. If you have fever, pelvic or lower abdominal pain, vomiting, you feel very unwell, or you're having heavy bleeding, seek urgent assessment. Those symptoms can suggest a pelvic infection like PID or another condition that needs prompt treatment. Here's the most empowering part: testing and what to ask for. In many cases, testing involves a vaginal swab. In a sexual health clinic, it may be self-taken or clinician-taken, depending on the service and your symptoms. Some clinics may look at a sample under a microscope. Others use more sensitive lab tests. The exact method can vary, but this one sentence at your appointment can change everything if you've been stuck in the BV loop. I keep being treated for BV, but symptoms come back. Can you test me for trichomoniasis as well? Say it plainly, say it confidently. You're not being difficult, you're being informed. And if it's appropriate for you, it's completely reasonable to ask for a full STI screen too. Trichomoniasis is treated with antibiotics, commonly metronidazole or a similar medication, prescribed in a specific regimen. Your clinic will choose the right option for you. And there are 3 treatment rules that matter just as much as the tablets. The first rule is to take it exactly as prescribed, not most of it. Not until you feel better. exactly as instructed. The second rule is to treat your partner or partners, even if they have no symptoms. Reinfection is one of the biggest reasons symptoms come back. And finally, avoid sex until the clinic says it's safe. That includes vaginal sex and sex toys. Follow the exact guidance you're given. One practical note: some antibiotics, including metronidazole, come with advice about alcohol. Your clinician or pharmacist will tell you what applies, so follow their instructions carefully. Getting the right diagnosis matters for comfort, but also for your health. Ongoing inflammation can make tissues more sensitive, sex more painful, and symptoms more disruptive. And untreated STIs can increase vulnerability to other infections. But the biggest point is this: you deserve effective treatment. You shouldn't have to keep guessing, buying products, or feeling like your body is mysterious, when the real issue is that the right test hasn't been done yet. This isn't a way to diagnose yourself. It's a way to know what to request. BV often has smell as the standout symptom, with thin discharge and usually not intense itching. Thrush is usually intense itch and soreness, sometimes thick white discharge, and often minimal smell. Trich can overlap with BV, but it often includes more irritation, burning, soreness, discomfort during sex, and sometimes urinary stinging. So if you're repeatedly treating BV and you still feel inflamed or sore, the next step should be testing, not another round of guessing. Here are words you can use. My symptoms keep returning after BV treatment. Please can we test for BV and thrush, and also trichomoniasis, because I know it can look similar. Can we do an STI screen, including chlamydia and gonorrhea if appropriate? If I'm positive, how do we arrange partner treatment? When is it safe to have sex again? If tests are negative but symptoms continue, what's the next step? The goal isn't just a prescription, it's a plan. If you've been stuck in that cycle of BV treatment and symptoms returning, let this be your reminder. You're not imagining it, and you haven't done something wrong. You're allowed to ask calmly and confidently, could this be something else? Because sometimes it is. Sometimes it's trichomoniasis, sometimes it's thrush, sometimes it's irritation from products, or a mix of more than one issue at the same time. And the good news is trichomoniasis is treatable, but it has to be tested for specifically. It isn't always included in routine swabs, and it can look a lot like BV at first glance. So if your symptoms keep returning, you deserve more than another quick prescription. You deserve the right tests, a clear explanation of the results, and a plan that includes partner treatment and reinfection prevention if needed. And if you want a deeper breakdown of BV, watch this video next. It explains what bacterial vaginosis actually is, what it isn't, including why it's not simply poor hygiene, and the most common reasons it can come back.